As we learn more about this virus, we are getting a better idea of its symptoms. For instance, in addition to cough, fever, and shortness of breath, studies have shown that diarrhea has also been found in patients diagnosed with COVID-19. This underscores the need for people to stay home, especially if you are sick. For businesses that are life-supporting, if you have an employee with symptoms, please tell them to stay home. As a pediatrician, I know that it can be hardest to tell healthcare personnel and first responders to stay home if you're sick, because we've been trained to work through it. But we cannot work through this illness. You have to stay home if you are sick, even if you have mild symptoms. This is not only for healthcare professionals, but for every life-sustaining business, including food services, grocery stores, and gas stations. Please stay home if you are sick. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow and not with your hands. Please try not to touch your face, especially after touching surfaces, and clean surfaces frequently. Practicing these everyday prevention measures can help slow the spread of the virus COVID-19. If you have questions about your health, please contact your health care provider. If you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. What is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe.
Thank you, Secretary. Could you recap the numbers in the beginning of your message? We had some audio issues.
I saw that. As of 12 a.m. this morning, we have 165 new cases of COVID-19, bringing our statewide total to 644 Pennsylvanians who have tested positive in 34 counties. Yesterday, we had 108 new cases per day, and today we have 165 new cases per day. Approximately 60 Pennsylvanians have required hospitalization since March 6th, when we first confirmed our cases of COVID-19. This is about 10% of people who have tested positive. 6,595 patients have tested negative for COVID-19 to date. Tragically, we have had 6 Pennsylvanians die as a result of this virus. They are all adults, and we've had 1 death in Allegheny County, 1 death in Lackawanna County, 1 death in Monroe County, 1 in Montgomery County, and 2 in Northampton County. Now, I would like to turn things over to Governor Wolf.
Thank you, Secretary Levine, and thank you all for joining me today. You know, we're living in a time unlike any other. The novel coronavirus has halted life as we knew it. Many of us are unable to go to work. Our children cannot go to school or daycare. Our social gatherings have been canceled. And all of this is made more difficult by our inability to gather in person with our loved ones for comfort. So I'm speaking very frankly to you about this situation this afternoon. All of us need to take this situation seriously. Most of us have not experienced a disruption in daily life of this type ever before. Our Commonwealth has not experienced a disruption of this magnitude in its supply chain since at least the Civil War, and will not come out of this unscathed. But if we work together, we can prevent more damage to our economy, more damage to our people and to our way of life. We must act as soon as possible, and we must act decisively. The City of Philadelphia has already issued a stay-in-place order, and I am issuing a stay-at-home order for 6 more counties right now. Beginning at 8 p.m. tonight, if you live in Allegheny, Bucks, Chester, Delaware, Monroe, or Montgomery counties, you must stay in your homes unless not leaving your home endangers a life. My office will be issuing guidance on allowable activities, as well as information for people who have no permanent home. This stay-at-home order will continue for 2 weeks. Our school closures and other mitigation efforts will be extended for another 2 weeks. And I'm asking everyone to participate to their fullest extent. I know this is going to be difficult, even more than it is already. These restrictions are unlike anything we've experienced before. We've become accustomed to being able to go to any store and purchase anything we want, whenever we want, to taking our children to an endless series of activities with their friends, to visiting our loved ones anytime we want. But if we want to save lives, we must distance ourselves socially. This is going to be difficult. I too have loved ones I want to be with. A few weeks ago, Francis and I had our 2nd grandchild, and we both desperately want to hold him. But for his safety and the safety of the rest of our family, we are distancing ourselves. And I'm asking all of us to do the same thing. This is not a request I make lightly. Pennsylvania is the birthplace of American freedom. Our economy and our way of life were built on this freedom, and it is this freedom I seek to preserve in our fight against COVID-19. The government will assist businesses with preserving our supply chain to ensure that every Pennsylvanian can get food and necessary supplies. Our roads will stay open, as will our pharmacies, grocery stores, and other life-sustaining services. We will protect everyday order and provide public safety. And our National Guard will be used to support health initiatives, not stay-at-home enforcement. The closure of businesses will bring economic difficulties to every single Pennsylvanian. And already, life has been made more difficult to hourly workers, to wait staff, freelancers, restaurant owners, and shopkeepers. And I won't pretend that things will not get worse before they get better. But what I will promise, is that the Commonwealth of Pennsylvania will do everything in its power to help businesses and workers during this catastrophe. The point is, before we can recover, we must survive. And to do that, every one of us must do our part. Just as any one of us can get COVID-19, any one of us can spread it. And that means we have to act as if we have it. We're fortunate to live in a time when we have the knowledge of how this virus spreads, and we must use that knowledge. We must stay 6 feet away from each other. We must avoid having other people in our homes. We must avoid touching surfaces that others have touched. We must avoid sneezing or coughing uncovered. We must avoid having unwashed hands, and we must avoid leaving our homes. So please, if you are in a county under a stay-at-home order, stay at home. Don't leave your home unless someone's life depends on your leaving, because ultimately someone's life does depend on you staying. This virus, is sneaky. You get it before you know you have it. Now, 80% who get it, they're going to be okay. And if you're part of that 80%, you could be forgiven for saying, so what's the big deal? The big deal is that 20% are in danger. And that 20% includes our loved ones and our neighbors. And the problem right now is that we can't treat the 20% if the virus takes off as it did in Italy. We don't have the capacity in our healthcare system. And so we need to buy time. Clearly, this is not a great answer, but it's all we have until our health system gets the stock of protective equipment like beds, ventilators, and other things our system needs to treat people with this disease. And the only way we can buy time is to distance ourselves from others. So please, let's work together to buy this time. As Secretary Levine said, stay calm, stay home, stay safe. Thank you. And now I'm going to send it back to April, and we'll open this up for questions.
Thank you, Governor. Our first question is from WHYY. You said that discipline of non-essential businesses that stay open will be progressive and will start with warnings. But beyond that, can you go into more detail about the process for being fined and what that would look like?
Yeah, the idea is that, and I think for the most part, businesses and I believe people in Pennsylvania are doing their part voluntarily. So the enforcement for this is that we have the ability under this order to actually cite businesses. We've used the Liquor Control Board to do things to make sure that bars are not open. But ultimately, this depends on the people and businesses of Pennsylvania to make the right decision. Again, if we don't follow this, if we allow people to congregate, if we don't stay at home, we're putting other people at danger. In many cases, people who are close to us, our friends, our neighbors, our loved ones. And that's what we can't afford to do. And so while there is enforcement in this, if we need to, the hope is that all of us recognize the shared responsibility we have to make this work.
As a follow-up to that, WHYY would like to know how many times will business owners be warned before they face fines and proceedings, and are those penalties up to date?
We have not even talked about how many times. We had a cabinet meeting by phone just a few hours ago, and the commissioner of state police said that at this point there are very, very few businesses that are not complying. So the enforcement issue is not really the key. The issue is making sure that all of us, businesses, individuals, recognize the shared responsibility that we have in making sure this works.
From the Tribune Review in Pittsburgh, what is the difference between a stay-at-home order and the previous order, and will there be a curfew?
No, there's no curfew. And I'm not sure what the difference is, that if you live in these counties that I enumerated, the Collier counties, Monroe County, and Allegheny County, and the Philadelphia County, unless you live in those counties, there is no change. If you live in those counties, we're saying you have done things to keep you in your home. We've closed businesses and asked restaurants to do nothing more than takeout. Now we're saying, to the extent possible, stay at home. Keep distancing yourselves. That's what's going to give us the time, buy us the time we need to allow our healthcare system to build the capacity they need to be able to treat all of us when and if we get this disease.
And then also from the Tribune Review, how many waivers have been granted to or originally deemed non-life-sustaining businesses?
The waiver process we've had thousands of waiver requests. I think the number, and you might want to check this, but I think 2,000 have been granted. A number have been turned down. And there's a third group of people who have asked for a waiver who didn't really need a waiver. So we're in the thousands of applications. We had a spike today. I don't know exactly how many came in today, but we're working through that. As the Department of Community and Economic Development is working through that as quickly as they possibly can.
For Dr. Levine from WPXI-TV, are there cases in Cambria and Center County? Are those people in isolation at home or in the hospital?
So I don't have the exact counties that are included. They are available on our website. But anybody who is positive, to test positive for COVID-19, is isolated at home.
And then from the Times News, Secretary Levine, if a death in Pennsylvania is attributed to complications from coronavirus, or coronavirus was listed as a contributing factor in a death, would the Department of Health include it in the daily report of coronavirus deaths?
Yes, that is correct.
For Governor Wolf from WJAC, if a stay-at-home if a stay-at-home shelter-in-place order is enacted statewide, would there be what would be different about that compared to the non-essential businesses that are shut down right now?
Well, first of all, I'm not sure that I quite understand the question. We only have the stay-at-home order for the southeastern part of the state, plus Monroe County and Allegheny County, which is we've done because that's where the outbreak has been. We don't have a stay-at-home order for the rest of the state. As for business closures, that is closing businesses. It's not a stay-at-home order.
And thank you, Governor. From the Associated Press, for people in the hard-hit areas being asked to stay home in place now, how should they be altering their behavior compared to the rest of the state?
They should ask themselves again, if they get up in the morning, is there any reason I need to leave my home? And if I do leave my home, am I doing that in a way that's going to save a life? If I'm leaving home to shop for food or get pharmaceuticals, those are important things, and we have to make sure you do that. But you need to ask yourself, do I really need to make this trip, or am I going to put someone else's life in jeopardy by making this trip? Am I going to be saving a life by staying home? And that's what we're trying to get people to recognize. This is something that adds to the social distancing, and it's something that's really important if we use the experience of other places, other states, something that will help us buy time, again, to allow our healthcare system to build the capacity they need to deal with this epidemic.
And then as a follow-up question, the Associated Press would like to know, have there been any reports of businesses refusing to comply with the shutdown directive since it entered the enforcement stage today?
I got to say, I don't know of any. As I mentioned earlier, the state police, Colonel Vanchek, said in a cabinet meeting today that only a handful of businesses had not complied with the request. I don't know that they refused to comply after they were told that they were out of compliance. So I just don't know of any businesses that have not voluntarily complied.
Governor, from Penn Live, it's been, now that we've reported a stay-at-home order for Pittsburgh, Philadelphia, and Monroe, if it's the case, why isn't it applicable statewide? Why aren't you doing this statewide, in other words?
Again, as I said, what we're trying to do is and I've tried to be measured in what Pennsylvania does. I want to act decisively, but I do not want to overreact. So we're trying to confine this stay-at-home order to the places where there's been an outbreak. There's not been an outbreak in lots of counties in Pennsylvania. The counties that are subject to this stay-at-home order are places where we've had a big outbreak. We need to do something. We need to actually do something to save lives and buy time, and that's why I'm focusing on those counties and those counties alone.
I want to emphasize that the mitigation efforts, the prevention efforts that the governor is putting in place are essential public health measures to prevent the spread of COVID-19 in those areas. As the governor mentioned, if we do not do this, then we would anticipate a large surge of cases, as was seen in Italy and other areas, and that could overwhelm our hospitals and our health systems. And so the goal is, with these prevention or mitigation efforts, such as the school closure, the business, non-life-sustaining business closures, and now the stay-at-home order for those counties, are put in place to emphasize the social distancing that is necessary to prevent the spread of COVID-19.
Dr. Levine, this question is for you from Penn Live. For nearly a week, the daily increase in the Pennsylvania count has ranged from about 30 to 45%. Does the percentage increase have much relevance, and is there any percentage figure that you're looking for as a signal of any major change in the course of this virus?
So those statistics are correct. About every 2 days, we are more than doubling the number of new cases of COVID-19. And so that is called an exponential rise in cases. It's going straight up. It's going straight up throughout the world. It's going up in the United States, and it's been going up in Pennsylvania. And that is why the governor is putting in place these prevention or mitigation efforts to try to bend the curve in terms of the number of new cases and prevent that surge we have been discussing that could overwhelm our hospitals and healthcare systems.
And then as a follow-up, Dr. Levine, there's been a substantial social media campaign to get people to sew face masks at home and give them to hospitals. This campaign seems very active in Pennsylvania. Is this a practical thing for people to do? What would the masks be? Would they be useful? Do Pennsylvania's hospitals need them or want them?
So, I mean, this is just an example of the compassion and of people in Pennsylvania, and they're wanting to contribute and to give. Unfortunately, the regular masks that most individuals would have are not the masks that hospitals and healthcare systems need. They need something called N95 masks, which are really designed to prevent the spread of respiratory illnesses such as COVID-19. We have masks that are available in our hospitals and health systems. They have stores. We have stores in Pennsylvania. We have more than 1 million masks that are available, and then we are receiving stockpiles from the national store of masks, and then we're looking for other ways to get these N95 masks, such as working with industries that might use them in manufacturing, etc. So although it is wonderful that people are trying to give their home masks to healthcare providers, they're actually not the masks that will be most necessary.
And then, Dr. Levine, we're going to start this question with you and then go to Governor Wolf. We've been getting a lot of questions about social distancing and whether or not the steps that the governor's taking today, whether it should apply for the entire state in terms of the stay-at-home. So can you discuss the social distancing compliance? Is that good enough? And then does it work in communities where it's taken hold? Mm-hmm.
So the social distancing that the governor has put in place, these prevention efforts, have been sequential, targeted efforts in counties that are most hit. As the governor mentioned, the counties that are included in this order are the ones that have the most cases and have evidence of community spread. In other counties, they might have either no cases or very few cases, and they really are not showing us evidence of community spread at this time. And so that is why this order is targeted toward those specific counties. I think that there is every reason to think that the efforts and the social distancing efforts will help us greatly in terms of preventing the spread and in preventing that surge from overwhelming us and eventually bending the curve of the rise of new cases.
Thank you, Secretary. Governor, go ahead.
No, I just want to add to that. I think Secretary Levine is absolutely right. Again, as I said earlier, here in Pennsylvania, we want to take a measured response, a measured approach to this epidemic. We don't want to do less than we need to do, but we also don't want to do more. So I think in targeting the counties we've targeted, we're taking that measured approach and focusing on the areas that really need it. And if we do and we're successful in this, then we won't have to spread this to the rest of the state.
Governor, we have some questions for you. First from ABC 27. Is there an agreement between you and lawmakers to move the primary to January 2nd, as reports suggest? If not, is it an idea that you support?
I do support it, and I don't think there's an agreement to actually bring it up to a vote in the different caucuses, and I think that is where it is right now. So we're a democracy, and the people who represent the citizens of Pennsylvania are about to make that decision, I hope, soon.
As a follow-up, Governor, ABC 27 has saying that they've heard PennDOT is recalling workers to their jobs at the PennDOT building near Shipoke. Workers are concerned about asymptomatic workers that could pose a threat and that social distancing guidelines are not being met. Are precautions being taken to protect those workers?
Yeah, I mean, we have over 70,000 employees in the state, but we need to do as good a job and work as hard as we can to make sure that we're keeping our employees safe. So, again, we had a cabinet meeting just a few hours ago, and we reaffirmed the need to make sure that we're doing things to keep our employees safe. So if there's something that isn't being done, then we will address that. I'm not aware of the Shipoke situation, but that's something that I'll take a look at.
And then, Governor, from the Associated Press regarding the stay-at-home order, under what circumstances are people allowed to go out, and how will that be enforced? Do you anticipate that it's going to come to the rest of the state, and how would you make that decision?
Well, we've talked about taking to the rest of the state. The hope is that we actually do a good job here and keep the coronavirus from spreading to the rest of the state. This is where these counties is where the problem is concentrated right now. And if we do a good job with the stay-at-home order and people respond positively, the virus will not spread. And I think that's what we're hoping for. So again, as I said, the guidance is that if you need to leave your home for a reason that is essential for your life, like buying food or pharmaceuticals, then by all means leave your home. But if you don't have to leave home, just keep in mind that by staying in home you might be saving a life, and that's an important consideration. That's what we're trying to achieve. I think if what we've seen in the business case is any indication, for the most part, we're going to get the people of Pennsylvania and people in these counties to voluntarily comply.
Secretary Levine, from WFMZ, how many ventilators are currently available in Pennsylvania, and what is the Department of Health and hospitals in the Commonwealth doing to try to accumulate more of them?
Mm-hmm. So we have daily statistics that we are gathering from the hospitals and health systems in Pennsylvania with the healthcare coalitions in each area and the hospital association. And we are tracking the utilization of those resources really carefully and are actually working to put up an official dashboard. Currently, there are 3,400 licensed ICU beds in the state. Approximately 40% of the ICU beds are available. It does fluctuate from day to day and sometimes hour to hour. In terms of ventilators, there are more than 2,000 ventilators across the state within healthcare systems, and so we're tracking the use of ventilators as well. In almost really all areas of the state, our hospitals and health systems are not overwhelmed by COVID-19, as was seen in Italy. And our goal is to provide resilience in that system and make sure that we have the resources available to equip the hospitals and health systems with the resources that they need to deal with that surge of cases that we are trying to prevent but could happen over the next number of weeks.
In addition, a follow-up to that, Secretary Levine, do you think that the area hospitals have enough to prevent a situation like we're seeing in Italy, where healthcare workers are having to decide who gets that life-saving equipment and who doesn't?
Mm-hmm. Well, the goal of the governor's efforts are to prevent that from happening. We have three pillars to our efforts. One is the prevention and mitigation efforts that we've been talking about throughout this press conference. The second is laboratory testing and trying to make sure that patients with symptoms get tested either through our laboratory, hospital and healthcare system laboratories, or through commercial laboratories. And then we have the mass testing currently in Philadelphia and Montgomery County, which has been hardest hit. And then the third is preparing our hospitals and health systems for that potential surge. And so we're working on plans with them and to provide the resources that they need to deal with that potential surge of patients that could happen over the next number of weeks. We want to make sure that they have enough masks, enough ventilators, enough beds, enough staffing. And so that is an effort, a collaborative effort with the Pennsylvania Department of Health, of course, the Pennsylvania Emergency Management Association, the county and municipal health departments that we work closely with, the Hospital Association, and with the hospitals and health systems themselves.
And then one final from WFMZ. President Trump was touting two drugs for the treatment of COVID-19. Do you encourage these medications to be used? Is there any concern about them not being able to be used for the diseases that they're meant to treat?
So there are a number of potential drug treatments that are being used on clinical trials that are being sponsored by the National Institute of Health. And I know that some of our great academic medical centers are involved in those clinical trials. And then for critically ill patients, I know that physicians, intensive care physicians, might try different combinations. But there is no approved treatment for COVID-19. There are potential options that are being investigated, and we hope and pray that those will be successful. But we need to know what medicines, under what circumstances, under what doses, how long. There's lots of information that needs to be known before we have an established treatment for COVID-19. In the meantime, yes, those medications have other uses, and so we want to make sure that they are available for the currently accepted uses of those medicines. And in fact, I've had communication with the Department of Human Services and Medicaid about that today.
From ABC 27, Secretary, a number of dentists have expressed concern that your rules require them to have negative pressure rooms to treat a dental emergency. They say that most dentists don't have them, and which would require them to send their patients to the regular ER, which presents its own health risks. What's your response to these concerns?
So yesterday we put out dental guidelines. They relied heavily on the CDC guidelines that had been put out, but we have had communications today with many dentists, including dental schools, about the challenge in terms of those negative pressure rooms. So we are looking at that now. There's a phone call in the next number of days with the dental schools and the Dental Association, and so we'll work through that issue and make sure that dentists are able to treat dental emergencies. We are recommending, as we are for all medical professionals in terms of hospitals, health systems, ambulatory surgical facilities, is that they treat emergencies or urgent cases only, is that we want regularly scheduled procedures that were not absolutely necessary, that were not an emergency or urgent, to be canceled or postponed, and to concentrate on patients that absolutely need that care. And that would include, of course, dental care. If you break a tooth or you have an abscess, that'll need to be dealt with. And I understand the challenges that the current guidelines are facing in terms of the dentists, and we'll work to fix that.
From Capitol Wire, Secretary, New York Governor Cuomo today called on the state's hospitals to increase bed capacity by 50%. PA's case numbers are not in the level of New York, which may be a function of our not testing as many people as had been tested in New York. Nevertheless, there are many parts of Pennsylvania with limited bed capacity. Even Philadelphia could potentially have far fewer beds during a surge. Have there been discussions with hospitals and health systems about how many beds might be needed and getting them online in the near term? So we are working on that as we speak. So again, this collaboration between the administration as well as the hospitals and health systems, the Hospital Association, the healthcare coalitions are looking at that whole continuum of care to make sure that we have the right type of beds and enough of those beds. That includes intensive care beds, med-surg, traditional hospital beds, and then subacute beds, and then beds for convalescents. And so there's lots of different things that we're looking at. We have waived regulations so that hospitals don't need our specific approval as they did before to add beds, and there are places within hospitals they might be able to add regular beds. We've also talked about repurposing ambulatory surgical facility beds since elective procedures are going to be postponed, and use those as hospital beds. And then we're even looking at hotels that might be possible to have for convalescents and subacute beds. So we're going to be looking at all of those possibilities. Governor Wolf, this question is for you from Penn Live. Can you elaborate on your decision to impose a general hiring freeze and a freeze on discretionary spending by state agencies? How bad is the state's financial picture looking?
We're like any other businesses. The revenues have softened pretty dramatically. I track that every day, and so I know what's coming in each day by category. and the tanking of the economy is affecting the state just like it's affected anybody else who depends on a revenue source. So we have to be careful, and we will. Obviously, the federal government is promising all kinds of support for states and businesses in states like Pennsylvania. So we're hoping that they come through. In the meantime, we're doing the best we can to live within our means.
And then, Governor, from news outlet in Wilkesboro-Scranton, the Wilkesboro-Scranton Times, we received a lot of questions asking us if their businesses should have to close. For businesses who are unsure if they're required to close or not, is there an avenue they have to obtain in writing a determination, or would they simply have to apply for a waiver and find out?
Well, we've actually put out guidelines. So if they fall within the guidelines, they don't really need anybody's approval. If they feel they are outside the guidelines, then we have a whole waiver process. And as I said, we've had 3 answers. The thousands of requests have gone in for a waiver and have gone back and saying, yeah, we'll give you a waiver. Thousands have gone in, or a number. I don't know what how many. If it's thousands, but a number have gone in, and we've denied the waiver. And then there's a third category of people who have asked for a waiver, and we said you really don't need one because you fall within the guidelines that says that you're essential. So there is a process. It's run, as I say, administered through the Department of Community and Economic Development. I think they're doing a good job of turning these requests for waivers around, and they're trying to be as responsive and sensitive to the needs of each one of these businesses as they possibly can.
And then, Governor, we have several outlets asking about the school closure extension. Is the school closure extension just for the 7 counties, or just for the that are under a stay-at-home order, or is that statewide?
No, it's statewide, and that's because if you'll remember, the original school closure order was for 2 weeks. This is the 2nd week, so as we come to the end of this, it's time to, well, in this week, it's important that I just say we're going to extend it for another 2 weeks, all across the state.
As a follow-up, some folks are asking, will schools be closed indefinitely? I'm
leaving open the option that I will do this right now for another 2 weeks, and that's the only decision I've made at this point.
For Secretary Levine, we have a question about local agencies and public quarantine sites from Spotlight PA. Washington, New York City, and San Francisco have brought in hotels and to house homeless people. What is the plan in Pennsylvania?
Mm-hmm. So there is a plan in Pennsylvania through the Pennsylvania Emergency Management Association and the Department of Human Services to have sites available for quarantine of individuals that can't stay at home. For safety's sake, we're not announcing where those facilities are, but they do exist and will be used when necessary.
And then, Secretary, as a follow-up, a few days ago from the morning call, they're asking that you made a comment a few days ago concerning Pennsylvania companies making medical equipment necessary to fight the crisis. Can you give an update on that?
So yes, we have purchased ventilators from a Pennsylvania company that makes ventilators, and so we're going to be providing those. We're also hoping that companies can work to provide the N95 masks, and so in collaboration with the Department of Community and Economic Development, we're really trying to marshal all of our resources to be able to provide necessary equipment for healthcare providers that are on the front line.
Secretary, from PCN, if a person interacts with someone who has tested positive for COVID-19, self-quarantined for 14 days, and then been released or cleared, are we confident that they're no longer communicable? Has anyone retested, continued to test positive, determine if they're still carriers?
So if someone was exposed to an individual who has COVID-19 and then they self-quarantined for 14 days, at the end of the 14 days, they're fine. So if they've never had symptoms during that time, there is no reason to expect that they will develop symptoms, and they can now go about their business. Now, of course, depending upon where they live, that might be staying at home still, but there's no continuation of the official quarantine.
And then from Erie Times News, Secretary, we have some viewers concerned about residents from potential COVID-19 hotspots traveling to secondary or vacation homes across the state. Do you have any guidance to issue to people who still may be traveling to their other homes? Are we considering some kind of domestic travel ban?
There are no plans either through the federal government or through the state for an official travel ban or a ban traveling to any other state or from someone from a state traveling here. But again, the whole message is that people should, if at all possible, please stay home. As the governor has said, go food shopping and get food that you need, get groceries that you need, life-sustaining activities. But otherwise, please stay home. And that's how we have our phrase of please stay calm, stay home. That way you'll stay safe.
Secretary, from WEEU-AM, I've heard of advice of washing hands to combat coronavirus. Can you tell us about the scientific reason as to why hand washing is an effective prevention measure?
One of the ways that people can contract a respiratory virus like COVID-19 is by touching surfaces. So if someone coughs or sneezes, that produces droplets. Those droplets go into the air. They can travel approximately or up to 6 feet, which goes with the idea that we should stay 6 feet apart from individuals, because then the droplets couldn't come to us. But if they're on surfaces, they can live on various surfaces for various amounts of time. If you touch that surface and then you touch your face, or then you eat food or something like that, then you can contract a respiratory virus like COVID-19. And so if you go out to the store, or you go out to for groceries, or you go out to to get gas, or you go out to the pharmacy, if you're touching surfaces, which you'd have to do to go about that business, if you touch your face, or you come home and you don't wash your hands, then you're going to spread those droplets, and you or your family could contract COVID-19. So that's why we emphasize the 20 seconds of hand washing.
Secretary, one last question. I have several outlets referring to New York Governor Cuomo mandating that the hospitals there increase bed capacity by 50%. Are we considering a similar order in Pennsylvania?
Well, it's not an order, and we don't have a specific percentage. But yes, especially in the areas that are harder hit, we're working with the hospitals and the health systems and the Hospital Association and the healthcare coalitions to increase bed capacity along the whole spectrum of care that will be necessary.
I have a question from the York Daily Record. We'll start with Dr. Levine and then go to Governor Wolf. Secretary Levine, what's your biggest concern this week?
My biggest concern this week is the continued exponential rise in new cases of COVID-19 in Pennsylvania. As we have talked about, every approximately 2 days, it is doubling. That is going up in a straight line, as it has in other places in the United States. And so that is the reason why the governor is implementing these assertive mitigation and prevention strategies to try to eventually trail off and bend the curve of those new cases.
Governor, same question to you.
Yeah, I agree with Secretary Levine. What we're worried about here, all of us, is that the spread of this disease is going to overwhelm the healthcare system. So we need to buy time to build up the capacity of the healthcare system. I think the question has been asked 2 or 3 times, are we actually working to increase the capacity of the healthcare system to respond to this? And the answer is absolutely yes. We want more beds. We're doing everything we can to get more protective equipment, ventilators, the things that doctors and healthcare workers need to respond to this crisis, so that we're not overwhelmed as they are in Italy. That's what keeps me awake at night.
Governor, as a follow-up to some of the questions on schools being out for another 2 weeks, ABC 27 would like to know what impacts that will have on graduation.
Haven't decided yet.
And then have you, from the Tribune Review, have you heard of churches that have had large services yesterday? What's your message to them?
Well, again, churches are like anybody else, the state, businesses who depends on cash coming in and church services or religious services or where that cash comes in. But those services are also where people come together, where they are together and they have less than 6 feet of space between them. That's where this disease can spread. And so while I recognize the challenges that every organization has to keep funds coming in, we also have to recognize the responsibility we have to each other to keep ourselves and our neighbors and our friends safe.
Governor, we're getting also a lot of questions in terms of the stay-at-home order and whether that means that people can go for a walk or run, whether they could walk their dog, or could they still go to a restaurant and get takeout?
They can leave their home to do things that are life-sustaining. If what they're doing is not necessary and it could possibly lead to somebody else getting this virus, they shouldn't do it. If what they're doing is something that absolutely has to take place to make life sustainable for them, like going to the food store, like going to the drug store, then by all means they should do that.
And then, Governor, as a follow-up to that, I'm getting a lot of questions about, while the cases are on the rise and people are understanding that there are 7 counties right now that are under a stay-at-home order, is there any end in sight for the social mitigation measures, and what metrics are you using to expand that to the rest of the state?
Yeah, and again, I think as Secretary Levine said, the mitigation efforts, we'll know when we're successful when we bend the curve of this, and it stops doing what it's been doing over the last couple of weeks, and that is going up at an exponential rate. We need to bend this. We need to buy time, and we use the metric right now is how fast is this rising, and to the extent it's rising 100% every 2 days, we are not yet at the point where we can say, okay, we've made some progress here. It is still going up, and at this rate, very quickly we will overtake the capacity of our healthcare system, and that is going to lead to very, very bad results. So what we're doing here is trying to make sure that we never get to that point in Pennsylvania. We're taking a measured approach, but we're taking decisive action to make sure that in the areas where this seems to be taking off the fastest, that we do everything in our power to mitigate that, to keep it from taking off.
Governor, last question. We're getting some questions about the homeless population and how we're getting the word out to them, and how we are handling the homeless population in terms of quarantine.
Yeah, as I mentioned in my comments, the homeless population, we have a special concern for. We're working with agencies on the ground in the counties where we have the stay-at-home order. And as Secretary Levine said, we're not divulging the addresses of those shelters, but we're doing everything we can to make sure that this message gets out through those agencies, and that they actually have a place where they can actually stay home.
Thank you, Governor. I'll turn things back to you.
Thank you. So I think you meant you're turning it back to me. I'm at home, so I can't see what you're doing. But I again appreciate everybody joining this press conference, and we will do everything we can to keep you updated and informed. So again, thank you for everything you've done to report on this, and to the people of Pennsylvania, thank you for making sure that we keep Pennsylvanians, our fellow Pennsylvanians, safe.